us.
All right. Good evening, everyone. I want to call this meeting of the Caldwell County Board of Health to order for November the 5th, 2020. And I want to welcome those who are joining us this evening by TV, as we don't have anybody in our audience. So everybody's joining by TV or Zoom from our board. And so we appreciate everybody being here. With that, I would like to ask Dr. Davis if he would lead us in our invocation, and we will follow that with our Pledge of Allegiance, and I'll ask the Honorable Wayne Rash, who is present here in the room, to lead us in that Pledge of Allegiance when that time comes. So, Dr. Davis, would you pray for us, please?
Absolutely. Bow your heads with me, please. Almighty God, we give glory and honor and praise to your holy name. You are the God of all wisdom and knowledge, creator of all that ever was and all that ever will be. And we're gathered here today to accomplish your will with love and unity as good Christian stewards. We thank you for all of your blessings and pray that you would direct and guide us not only for this meeting, but for the rest of our days in our life. Please point us to the truth and help us to protect the health and the well-being of each and every citizen here in Caldwell County. Thank you for the dedicated staff of the health department, and protect them as they work exceptionally hard to mitigate the effects of this pandemic. With love and harmony for each other, we ask all of these things in Jesus Christ's name. Amen.
Amen. So
Please stand with me and join as we do the pledge. Attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
thank you, everyone. With that, our first item is announcements that we may have this evening. Do we have any?
Sure. Just a few. We had our rabies clinic from Animal Control. It was held on October the 24th. They gave 372 vaccines. I did want to mention a COVID update. I know Chad's going to do a little bit of COVID preparedness, but I wanted to give an update to you guys. The total positives as of this afternoon was 2,727. Recovered 1,805, hospitalized 20, and 33 deaths. We do have an outbreak at the Share Center. It's being managed by the Health Department and Share Center, working with them to get people tested and treated. You guys might have noticed we've seen an increase in cases lately. There's a lot more testing going on, more testing sites, so that's why we've seen a lot more cases. There's no extended clusters or outbreaks that we've been identified as of tonight. However, we've noticed that gatherings and events seem to be a common denominator when we call people, whether it be weddings, churches, things like that, any kind of gatherings. It seems like that was a common denominator. They went somewhere. The health department just urges social distance, staying home if you're sick, and good hygiene to reduce the spread.
All right. Well, we will hear more about that as we move through our meeting, I'm sure. So, are there any agenda amendments this evening?
There is one we want to add under item 9, drug-free Caldwell grant proposal by Taylor Hoover.
All right. With that addition to our agenda, do I hear a motion that we adopt our agenda that has been presented this evening?
So moved.
Dr. McBurney, do I hear a second?
Second.
Somebody did.
Sandra.
Sandra, okay. I think we're going to have to start identifying our names too, so we can get it in our minutes, but that's okay. Sandra seconded. So all in favor signify by saying aye. Aye.
Aye.
Any opposed? And so we have an adopted agenda this evening. And the first item on our agenda is the approval of our minutes from our October 1st, 2020 meeting. I trust you've had an opportunity to review those, and if you have, do I hear a motion that we adopt those minutes from October 1, 2020?
Mr. Chairman, motion that we approve the minutes from the October 1st meeting.
All right, do I hear a second?
Second.
All right, Dr. McBurney. So all in favor signify by saying aye.
Aye.
Any opposed? And hearing none, that is unanimous. And we now are moving to our financial report. Miss Jeannie Walker, who is here with us this evening, and she's going to give us our updates.
Good evening.
Good evening.
Tonight we have a budget summary for the month ending September. We've currently expended 22% of our budget and received 35% of our revenue. So we're in good shape.
We're in good shape, you said. That was the
Yes.
best comment. All right. Hearing that update, is there any budget amendments?
We do not have any budget amendments tonight.
No budget amendments. And next, I see here a small balance write-off.
We do. As many of you know, the Health Department participates in the debt set-off program, and that's for clients who have been placed in a debt set-off where they have a past due balance, usually over a 3-year period. And so they're placed in debt set-off if they owe more than $50. And so that if they file taxes, then those balances can be collected through their tax return. So in 2019, we had 101 counts that were placed in debt set-off. That totaled $16,575.23. After people receive notification, because they're notified that they're going to be placed in debt set-off, 41 of those accounts were added to the clearinghouse. That totaled $9,847.98. During 2019, the Health Department received $20,789.38 from debt set-off collections for clients that had past due balances. To date, the Health Department has collected $710,692.58 from individuals who've been placed in debt set-off. This year, we're asking for 65 accounts to be placed in a write-off, and that amount totals $1,453.45. So that's what we've not been able to collect. And that's individuals who owe less than $50.
All right.
So, again, that's $1,453.45.
Yes, ma'am. So for those of you that may not be able to hear Jeannie well, she has 65 accounts that have went through the total process that we need to place in the debt set-off, and the total amount is $1,453.45. So do I hear a motion that we place these in debt set-off?
It's a motion to write.
Well, this is a write-off. This is, they've already been placed, yeah.
Motion to write off.
Yeah, to write off this amount.
Yes, ma'am.
Yeah, because they've already been placed in debt set-off. This is
That's
what we
right.
couldn't collect.
So we'll write those off in the amount of $1,453.45.
That's correct.
Mr. Chair, I'll make a motion that we write off that balance of
$53.
Sorry, I did not have it written down in front of me, but then we'll write off that balance as uncollectible.
All right. Do I hear a second?
I'll second. Yep.
All
Second,
right.
Dr.
Any other discussion or comment? I would like to say that I wrote some of those figures down, but to come from one figure was 15,000, another added to it was over 9,000. So you start 20 couple thousand to get back down to where it's just $1,453.45 is pretty aggressive, and I appreciate the effort that our staff has put forward into collecting as much as they possibly can, and so I appreciate that and wanted to say that. So with that, I'll call the question. All in favor of writing this off of $1,453.45 signify by saying aye. Aye. Any opposed? And if you're opposed, we'll take a check in the amount of $1,450. No. All right, so that motion carries unanimously. And we've had a few more board members join us. I thought I saw April pop up there somewhere. So,
Angie.
I'm sorry, Angie.
Yeah. Hi, Angie.
It's been a day.
Sorry about that.
Yes, ma'am. It's good to see you.
Thank you.
All right, so next is
Okay, we have one more write-off.
Oh, you
Sorry.
got one more
Sorry.
write-off.
Yes.
Wait a minute now.
We have another write-off, and this is for clients who are not eligible for debt set-off, either because we don't have a Social Security number for them or they don't file taxes. So for that total, we're asking to be written off is $28,517.22. Keep in mind that these accounts are usually more than 3 years old. They've had no activity for the past 3 years. And a lot of this is when we transitioned to our new electronic medical records, QMD, which happened in September of 2017.
Yeah.
So a lot of these are 3 years old. So
Okay. And let me ask this in reference to that, though. Would that prohibit somebody from receiving treatment if they came in and you found out they owed? Or can we collect at that point or find a better way to?
Yeah, we always ask whenever they come
Right.
in if
Yeah.
they can. And whenever they come through, we tell them how much they owe and try to collect at that
And
point.
set it up on a
And set
payment
it up.
plan
Yeah.
or get more information, a social security
Right.
number or something?
Yeah.
Right.
So we can,
but they will not be denied treatment.
right.
Yeah.
And maybe I didn't put that the right way, but just making sure that we are tracking that.
Yes.
Right.
Yes. Once
Because a lot of
they
times-
come back in, then their accounts are reactivated.
Yeah.
So if they have an outstanding balance, then
Because a
it'll
lot
go
of
through
times
that
we
process
know-
again.
That people will come back.
Yeah.
But a lot of this too is probably some transient folks that are passing through, moving on to somewhere else.
Yes. Yes.
So these accounts have not had any activity for 3+ years.
That's correct.
And I got 28,517.72.
22.
22.
Yeah.
All right. So that's the big accounts that we're going to write off.
Yes.
But if you didn't understand that, the amount that has been requested to write off in this case, for those folks that haven't, we don't have any information to go back to their taxes or anything else, is the amount of $28,517.22. So I'll make the motion that we write that off as non-collectible and ask for a second.
I'll second.
Sandra Jane seconds. And so is there any other discussion or comment? Hearing none, I'll call the question. All in favor, signify by saying aye. Aye. Any opposed? And hearing none, that motion carries unanimously as well.
Okay. And one thing I'll mention, maybe they'll answer your question earlier about do we make attempts to collect those. One thing that changed with QMD is they have to show proof of income, and they have to bring a copy of their tax return if they file taxes. So that's
Right.
changed since we switched to QMD.
Yes, ma'am.
So,
Well, that's good, too. All right. So you're sitting down now. You're done. I'm sorry. I will make sure. So that moves us to item 9, our public health updates. And the first one is Cameron Spencer. And I think he's...
All right, give me a second, guys. Okay.
And we're bringing that up. This technology is great.
Can y'all see the screen?
Yes. Yeah.
Yes.
There you go, Cameron. Once I get this. All right. Hello. My name is Cameron Spencer. I am the current QI chair, and I'm going to present some of the stuff that we've been doing this year in QI. Here's our pretty little QI sign that we just like. Of course, QI, quality improvement, the idea is employees can present ideas they have about how to improve their lives individually or for the employees to us at the QI council. And then it goes in our 4 categories. Of course, not possible or not QI, can't help them, unfortunately, or breaks into QI work groups, or it's the entire QI team. So for us at QI this year, it's been a little slower because of COVID. We haven't got as many submissions. Some things that we did this year, of course, we put out our QI newsletter that we do every year. And we worked on the QI tour, which is required for accreditation. The big project, of course, this year is our QI survey. This is the 2nd year with the new format. So we are real excited to look at our trends from 2019 to 2020. I think that goes right into it. And just a recap of the questions. So this particular question, this says question 3. The first 2 questions is just your department and management team. But knowing what's expected of me at work, this unfortunately was a negative trend this year. You can see that the strongly agrees did go up, but the total agrees went down, and we had more disagrees. I believe with COVID, things get a little bit more murky around here. The health department, what caused this negative trend. If you notice that not all the percentages add to 100, if you're checking my math, I did round the numbers to make them nice and pretty. Let's see here. Question 4, having the materials and equipment I need for my work. This was a overall positive trend. So that was good. Let's see. At work, I have the opportunity to do what I do best every day. This one was unfortunately a negative trend, losing a few agrees. In the last 7 days, received recognition. This was a positive trend, thankfully. Looking up, and you'll notice there's a trend of most getting a lot more strongly agrees this year and losing a few agrees of those. And this was one of our bigger jumps of this past year. Let's see here. Question 7. Supervisor or someone at work seems to care about me as a person. Once again, another positive trend going up this year. Someone at work who encourages my development. This is one of our really good positive trends this year. So that was good to see. At work, my opinion seems to count. This was our biggest loss this year, having the most disagrees, overall going down. Not very much in the agrees, but had the most disagrees. Hopefully, going into the future, we can get more people encouraged to submit suggestions to the QI board so that every opinion is heard, because we will help anybody with a suggestion of how to make work better for the individual or for customers. Question 10, mission and purpose of the company makes me feel important. That was a positive trend, looking good there. Question 11, my coworkers are committed to doing quality work. Once again, another positive trend looking there. I have a best friend at work. This is one of the few that we actually dropped in the strongly agrees and had a jump in the agrees, but overall it was still a positive increase. In the last 6 months, someone has talked to me about my progress. Once again, another positive there. And opportunities to work, at work to learn and grow. This one, unfortunately, was another drop. We do have 2 questions for fill in the blank as well. What suggestions do you have to improve the health department? Improving communication from upper management to the rest of the staff. We get those often, so hopefully the management team will be able to work to get information out to other staff members. To make them feel more connected to that. And of course, what do you think the health department does well? Of course, we have 2 positive for patients. We have education, and of course, our wonderful leaders that let us know that we are appreciated. And I did run through those questions very quickly. If anybody has any questions, I can always go back to them. But do we have any questions today?
Anybody have any questions?
All righty. Well, if you have any questions, you're always welcome to ask. This is my third year presenting, so I will be rotating off of the QI board. So thank y'all for listening to me the last 3 years.
Thank you.
Thank you. And we're allowing Chad to make a change over there, but he's going to give us an update, Mr. Coffey, Chad Coffey, on flu preparedness and COVID preparedness.
All right, so hey, everybody, hope you're doing good. We're going to talk a little bit about flu season, and then we'll go into COVID-19. So we're going to look at flu under the microscope. So taking a closer look at the flu, some of the facts: the flu is a respiratory illness, usually infects the nose, throat, and lungs. Your symptoms can range from being mild to severe, and that's different per person. 2018, the CDC stated that around 8% of people in the United States got the flu. You're most contagious the first 3 to 4 days that you're infected, and children, older adults, and people with chronic conditions such as COPD, asthma are at a higher risk, and going back to the symptoms, can have the more severe symptoms that can lead to hospitalizations and in some cases death. Some of the symptoms, you'll notice that these are a lot of the same symptoms as COVID-19. That includes fever, cough, sore throat, runny nose, headaches, body ache, fatigue, and nausea. Not saying that you'll get all those symptoms at one time, but those are the most common symptoms that we see throughout the flu season. And so when is flu season? So just like baseball and football have a season, flu has a season. It's pretty long. It runs from October to May, with your peak months being in January and February, and that's due to your colder months, and that's when the virus thrives, is in the colder weather. Also, people are around each other more in the colder months. You're inside, and that's how the virus spreads more easily. And believe it or not, you can actually get the flu in the summertime. It's harder to get the flu in the summertime due to the hotter temperatures making it harder for the virus to survive, but you can technically still get the flu in the summer. So there's two main ways you can prevent getting the flu, and the number 2 way is hand washing, which I'm sure everybody's very familiar with this since COVID-19. It's been here since March, hand washing, but typically it's severely overlooked, can be completed in 5 easy steps. It's not rocket science to wash your hands. Using hand sanitizer when soap's not available is always a good thing. Soap's obviously, hand washing is your top tier level, and then if you can't do that, trying to get hand sanitizer is 60% or greater alcohol. And I know, especially COVID-19, most people go wash their hands and then go to the table and then use hand sanitizer. That's starting to become a practice now. And the sanitizer, like I said, is not able to get rid of all the germs like washing your hands are. Then going to the steps for hand washing, most people know how to wash their hands, but the step that's typically overlooked is the length of time that it takes to wash your hands. That's going to be 20 seconds. Most people, especially in today's society, want everything. Everything's very fast-paced. You've been working all day. You go to McDonald's, wait, 15 minutes to drive through because they're slow. You get home, you want to eat your Big Mac, and wash your hands really quick. But just taking the time to wash your hands for 20 seconds, which is as simple as humming happy birthday to yourself twice. Then going on to the number 1 way to prevent the flu is the flu shot. The CDC said it is the best way to prevent the flu. We get a lot of questions, from the public sometimes about, I have like a 2-year-old get a flu shot, and yes, they can. Everyone 6 months or older can get a flu shot. I'm not saying the flu shot is going to put a force field around you, protect you from the flu, but it can definitely improve your chances of fending the flu off, or even if you do get the flu, making your symptoms less severe. It's also highly recommended for pregnant women and people with those chronic conditions that I listed earlier, the asthma, COPD, get the flu shot to help protect them. And the common myth is that the flu gives you the flu shot gives you the flu. I hear that all the time. I got the flu from the flu shot. That's not true. Whenever you do get a flu shot, some people do react differently, but you might feel bad for a day or two. That's just your body's response to make antibodies to the vaccination that you received. And then on average, it takes about 2 weeks for antibodies to develop after the flu shots. Some people, they get the flu shot, get the flu before the vaccines had time to make antibodies to help protect you. So we did have our flu drive-through this year. We held that on September 26th. We had that here at the health department in partnership with emergency management. We gave over 170 vaccines, and we're still getting flu shots through our clinic throughout the entire flu season. And we do have high dose, which is for 65 years of age and older. And like I said, the appointments are made through 828-426-8400. And we also have our after-hours clinic, and that's ran, I believe it's from 5 to 7 on Tuesdays. That's doing flu vaccinations as well. So going on to the COVID-19. So just some of the numbers, and I made this presentation on Tuesday, so some of these numbers might be a little outdated, but we've given over 30,000 COVID tests have been administered since the pandemic began in around April in Caldwell County. Out of the population of about 80,000 people, only 2,652 have been positive, and that's less than 10%. I think it comes out to be like 8.62, I think. So there's been over 27,000 negative tests to date in Caldwell County. And I believe we have had one more, so I think there's been a total of 33 deaths in Caldwell County due to COVID-19. So as far as outreach goes, the Caldwell County EOC, which stands for Emergency Operations Center, has been open since April. We have an established phone line for the public to call into, and we answer questions all the way from people want to know where they can get tested at to different situations that might arise in the household or at their business. And that's also in partnership with EM. We have daily communication with the hospital on a conference call every day to make sure we're approaching this at a joint level to respond to the pandemic. Our staff has been numerous trips to different nursing homes and assisted living facilities to do COVID testing. We've had several businesses that have reached out that we went and tested, and also we've had a couple of people in the county that are homebound, and we've made special trips to their house to do the COVID test there. We've had several drive-through clinics in the community. I know we've had at least one or two here at the health department, and one we did at South Caldwell High School to try and make testing more available to the public. We've also the health department staff have been contact tracing, so all positive cases in the county do come to the health department, and we use contact tracing as a means to try and stop the spread as much as possible. And that is just entering information into a system that the state has about patient symptoms, and also going through the major part of that is making sure anybody that's been around since they've been positive, whether it be the household, best friend, birthday party, church service, making sure that we get all those people and can tell them that we recommend to get tested to try and stop the spread. And then going into the future preparations, we've received several grants over the course of since March, and we're in the process of, we have 4 vaccine refrigerators on the way, and they should be here at the end of November or early December to store the vaccine when it does come out. From what we've heard, when the vaccine first started being made, it had to be stored at a very cold temperature. I think it was minus 80 degrees Celsius, which most places do not have the capability to do that. So I do know they've been working on a means to try and get that to a more containable temperature for hospitals and health departments. But those will be here hopefully by the end of the month. And we've also purchased several pop-up and drive-through tents to help do vaccination clinics to the public, which is what we plan on doing whenever the vaccine comes out in the county, and do vaccination clinics. The major thing that's been bought is PPE. Because always, it's important to protect the public, but also very important to protect our own staff. So that includes gowns, gloves, goggles, face shields, things like that. We've also purchased vaccine coolers, which help keep the vaccines cold, or even the testing supplies cold, so we can go to different locations and not have to worry about the temperature being controlled. And that is all that I have.
All right. Any questions from anyone or comments?
I have a question. The high-dose flu vaccine, is that quadrivalent this year or trivalent?
Quadrivalent, Sandra.
I believe it's quadrivalent.
Okay, thank you.
All right, and I have a question, and it just wondered about when we're tracking the people in Caldwell County that's receiving tests, if you get a test outside of Caldwell County, does that track back to Caldwell as well?
Yes, so if they reside in Caldwell County, it will track back here.
Okay.
The facility who does the testing will send the results to us, and then we contact the patient. So it would be in our numbers if they reside in Caldwell County. If they work in Caldwell County, but they live in a different county, we would then, the provider would then fax results to the residing county.
Okay. Just wondered that. So, and appreciate all that our health department has done in the testing and getting things in order for that. So just want to say thank you there. Anybody else got a question or comment of Chad? All right, with that, then we added an item this evening. Miss Taylor Hoover's going to bring a report on I wrote drug-free down.
And this will be an action item, a proposal to take to the commissioners.
An action item is a proposal to take to the commissioners.
Good afternoon, everyone. My name is Taylor Hoover, so I'm a health educator here at the health department. I also wanted to introduce to you Brian Austin. He's also on the Zoom call today. He is with Youth Preventative Services with VIA. So I'm also the chairman of Drug Free Caldwell. It's a community coalition, and Brian is a vice chair. So Drug Free Caldwell, you may have heard of us before, but we're a community coalition, and the host agency is the health department. We meet every month, typically here in the building, third Thursday at 8 a.m. Right now we're meeting over Zoom. But our mission is to create a more connected, productive, and healthy community for adults and youth in the county. And we do this by reducing substance use through education and community engagement. So Drug Free Caldwell would like to request to apply for the Drug Free Communities Grant. So this grant would provide $125,000 per year to Caldwell County for up to 10 years. The Caldwell County Health Department would be the fiscal agent for this grant. So this grant is a program that works to reduce specifically youth substance use rates in counties across the country. Some counties that you may be familiar with, Mitchell and Yancey and Polk County already have this grant in place in their counties and are working with it currently. So we would use these funds specifically to provide a grant coordinator, which would potentially be a full-time position, and then a prevention specialist, which would be a part-time position, and then a youth coordinator, which would be a part-time positions, and they would all work in Caldwell County. That's very flexible, so that could be rearranged to fit however need be, but that's kind of the model that the other counties have used. So more specifically, these positions would target providing information, building skills, providing support, enhancing access and reducing barriers, changing consequences and physical design, and of course, changing policy. Another important task to us is going to be gathering data on youth in Caldwell County specifically about substance use. That's one of the areas that we're kind of lacking right now. So we feel like that's very important to be able to address the issues, to identify what the issue is to begin with. So having these positions would allow us to spend the necessary time to reduce substance use in the county and would change the social norm of acceptance around substance use that we see. So currently on Drug Free Caldwell's coalition, we have a lot of active members. We have law enforcement, so LPD, Sheriff's Office, Granite Falls Law. We also have community and schools and Caldwell County schools represented. UNC Healthcare and Helping Hands, and a lot of other organizations, including VIA, RHA, NC Works, and Yoke Bellow, just to name a few. So there's a bunch of different key community members that are currently working on this organization now. So we believe with our collaborative efforts between our key community members and the funds provided from the CDC that we will be able to make a distinct impact on reducing substance use in Caldwell County. Does anybody have any questions?
And just to reiterate, you said this grant was for $125,000 annual for up to 10 years.
It is, and I believe at the 5-year point is when you could reapply. So it would be guaranteed 5 years, but then at the 5-year point you would reapply, so potentially up to 10 years.
Okay. Anybody have any questions? Well, hearing none, I'll ask for a motion to allow Drug-Free Caldwell to apply for this grant.
Mr. Chairman, I'll make a motion that we allow Drug-Free Caldwell to apply for the grant, the $125,000 a year grant.
All right. Do I hear a second?
I'll second it. Don Davis.
Dr. Davis from Egypt.
Germany.
Germany, I'm sorry. It's been one of them days. All right, so we have a motion and a second. Any other discussion or question? I'll call the question then. All in favor signify by saying aye. Aye. Any opposed? And that motion carries. Thank you, Taylor, for your report. Anything else? I know we had a little discussion prior to our meeting this evening about our typical December activities and meeting, and feel that it's probably best that we not engage in our normal course of action, which is typically a dinner in which we would all sit down together and have a meal. And so we were going to dispense with that this year because of our current situation and the things that are going on with COVID. And with that, then there would probably, unless some major issue comes up, we wouldn't have a meeting in December. Anna will be forwarding some information to each one of us for a review and answer back in an email to her, just to let her know that you have been provided some information that goes toward our accreditation with the health department. And so it'll just be information for your review, but it is a tracking process to make sure that each one on the Board of Health gets that information. So when you see that, I guess if you just respond back received or thank you or something, so she can have that as a record for that time when it comes time for the review of that. And then typically, unless something occurs, we usually don't have a meeting the first Thursday in January, which falls right around our January 1, New Year's Day. So it looks like we may be not having a meeting until February, unless something again comes up, and we can always call an emergency action together and get everybody involved in a Zoom meeting. So anybody have any comment or discussion about any of that? All right. Well, with that, I'll entertain a motion to adjourn this evening.
I'll make a motion.
Thank you, Sandra. Do we have a second? Dr. McBurney seconded. Okay. All right. Dr. McBurney, I think, seconded. So with that, all in favor of adjournment this evening, signify by saying aye. Aye. And with that, we are adjourned. And I get to say this the first time. I'll see you folks next year.
Wow, see you next year.
All right. Thank you, everyone.